will do the visuals in this model. We will start by this one. This is the left subclavian vein. You can see it has two tributaries. This is the internal jugular vein. It drains here. Here is for the external jugular vein. They will form the subclavian internal jugular vein, the brachiocephalic vein. Okay. Now, as we have the subclavian vein, we have subclavian artery. You can trace it or appreciate it here, lying back to the anterior scalene muscle. This one. This is the third portion of the subclavian artery. Now, basically, you know that subclavian artery will give the thyrocervical trunk from its second portion, and here is the thyrocervical trunk as it's written in the catalog. This X-like structure. Okay. If you want, you know that the thyrocervical trunk will give the inferior thyroid artery, which will supply here inferior portion of the loop. And if we want to appreciate it, we have to go here. Again, this is the subclavian vein. Okay, here is the subclavian artery deep to the vein, and here we are. This one, which is going like this this one is the internal thoracic artery, or the mammary artery. This one, okay, and this one, as it's going, this one is the inferior thyroid artery. So this is the internal thoracic, this is the inferior thyroid artery coming from the subclavian artery. Okay. Now, you know that we have the aortic arch. It's not shown, it is in the thorax, not shown in this model. Aortic arch will give the common carotid, and you know that we have here, this is the left common carotid, this one, the left common carotid. Now, the common carotid will bifurcate at the level of the upper border of the thyroid cartilage. So you can here approximately see the bifurcation. See here, this is it will give the external carotid artery, and internal carotid artery, this is 119, which will go deep inside. This one. External will stay here. This is the external carotid, and we will mention it is branches. Now, the external carotid artery will have anterior branches, posterior branches, and terminal branches. Okay. Now, starting with the anterior branches, the first branch that the external carotid artery will give is this one, which is the superior thyroid artery. Okay, so superior thyroid artery, and first anterior branch that the external carotid will give. This artery, which piercing the thyroid membrane, this is called the superior laryngeal artery. Superior laryngeal artery, superior thyroid artery. And we mentioned that the inferior thyroid artery coming from the thyrocervical trunk. Okay, moving, we have two other anterior branches of the external carotid. We have this one, you can appreciate how it is going to the face. This is the facial artery, and we have this one, okay, this one, which is going to the tongue. This is the lingual artery, this one. Okay, this is the three branches: superior thyroid, lingual, and facial. Now, going to trace the posterior branches, there are two for the external carotid. We have this one, which is posterior auricular, and going here, this is the occipital, and posterior auricular, two posterior branches. For the terminal branches, we will have this one. This is the maxillary artery, okay, and this one is the superficial temporal artery. Okay, so just to make sure that the superior laryngeal artery, it is a branch from the superior thyroid artery, okay, not the external carotid. Okay, there is also for the external carotid another medial branch. It is not shown here. It's called the ascending pharyngeal artery. Now here, again for the subclavian vein, here this is the external jugular vein. This is the external jugular vein, which will drain here. You can see how it will drain here. internal jugular vein will be with the common carotid, and they will form the carotid sheath. Okay, this is the internal jugular vein with the common carotid. They will form the carotid sheath. Wait. Okay, so lastly, I have just to mention these. They are not related to the neck, but just to mention, this is the rib, first rib, I think. Okay, and we have the intercostal groove, and it has the intercostal vessels. It has the vein, artery, nerve. So this 1 to 5, the blue one, the vein, this is the first posterior intercostal vein. So this is the first posterior intercostal vein, and this is the posterior intercostal artery, and this is the intercostal nerve shown here. This is the spinal cord. This is the body, spinous process. This is the esophagus. This is the trachea. Okay.